Seja bem-vinda ou bem-vindo a mais uma sessão do Congresso Acadêmico Unifesp 2020.
So good morning. My name is André Roncalha, and on behalf of the São Paulo School of Politics, Economics, and Business, EPEM Unifesp Campus Osasco, it is my honor to be hosting the session today with our two very special guests, Dr. Martin Ravallon and the session commentator, Dr. Naércio Menezes Filho. Both of them were very kind to accept our invitation to be with us this morning. And before I move on, I'd also like to thank the organizers of the session, Professor Solange Gonçalves and Professor Gabriela de Brelas, for their hard work in setting this meeting, which will touch on the socioeconomic determinants of the vulnerability to COVID-19 and their policy implications. Now, both our speakers today have very extensive curriculum, so I'll just point out a few aspects of them so you understand how great an opportunity this is for us to be listening to them today. So our keynote speaker is Professor Martin Ravallon. He is the Edmund Villani Professor of Economics at Georgetown University in Washington, D.C. He was the director of the World Bank's Research Department, an institution where he worked for over 2 decades, advising numerous governments and international agencies on matters related to poverty and policies to fight it. He's also a world-renowned development economist with 5 books and more than 250 papers in academic journals and added volumes. So in order to match that academic excellence, we invited Professor Naércio Menezes, who is one of our top researchers in economic development in Brazil. Now, he is the professor at the Department of Economics in both the University of São Paulo and INSPER, where he is also the director of the Center for Public Policy, among various other consulting and advisory works and initiatives. He's also published in prestigious Brazilian and international academic journals, and he writes a newspaper column on Valor Econômico, which I think most of you follow and know. Now, Professor Ravallon will give us a talk on poverty, inequality, and the new coronavirus. His recent work, alongside his co-authors, has looked underneath the veil of the contagion and the death rate curves that we've grown so used to say we need to flatten, to point out how socioeconomic aspects such as race, gender, and age affect not only how the disease spreads within a given population, but also the severity of the disease once an individual or a group is infected. So needless to say that these socioeconomic aspects are closely related to how income and wealth are distributed in a given society. Now, in the last 24 hours, Brazil had over 1,200 deaths and almost 40,000 newly reported infections, reaching, since the beginning of this pandemic, over 75,000 deaths and nearly 2 million reported cases. So given the glaring inequalities that characterize Brazil, their thoughts, I'm sure you probably understand, have much to enlighten us on how challenging is the road ahead before we can say we have effectively overcome this pandemic, as well as its effects. Now, how this is going to work today, Professor Ravallon's lecture will take about 50 minutes, after which Professor Naércio will make some comments and raise some questions for further reflection. The audience is more than welcome to pose their questions to our panel, but it must be done through the chat inside this virtual room. In case English does not come easy for you, you can pose your questions in Portuguese, and Professor Solange and I will do our best to translate them to our guest speakers. So without any further ado, I thank everyone watching us from home again, and I thank our guest speakers, of course, and I give you Professor Martin Ravallon. Thank you very much.
Thank you very much.
Martin,
can you hear me? Okay. I think we got just 6 months now since the new coronavirus started wreaking havoc on our lives across the world, and 14 million cases globally, 600,000 deaths. And Your country, Brazil, has certainly been one of the worst affected. The country I live in, the United States, is even more so, 140,000 deaths and some 3.5 million cases. In fact, Brazil and the United States have the unfortunate honor of accounting for 1/3 of the deaths globally from COVID-19. And it looks like it's only going to get worse. I'm an economist. I'm certainly not an epidemiologist, but with my co-authors, Caitlin Brown and Dominic van der Waal, we've been trying to dig more deeply into understanding the behavioral responses, because we believe that a lot of formal epidemiological models have been extremely useful, but the formal models themselves tend to relate to relatively homogeneous populations, and of course that's not true. And as economists, we understand that the constraints people face in their lives and the behavioral responses to those constraints can be hugely important to all aspects of their lives, including their health, including their response to this virus. We know that the pandemic is increasing poverty globally. There's no doubt at all about that, but we're talking about estimates from 60 to 100 million people falling below the World Bank's rather frugal $1.90 a day poverty line. And you use higher lines, the numbers are going to be substantially larger, I expect. And this is disturbing, of course. How long this is going to last, we don't know. But what we're going to talk about today is really, we're going to focus very much on the implications of poverty and inequality for the spread and the severity of the virus, rather than the other way around. How much is it impacting poverty and inequality? How much is poverty and inequality impacting the virus and feeding back into the lives of poor people globally? The two messages from this talk: the socioeconomic inequalities that underlie vulnerability are real, and they're also quite complex to disentangle. It's always a risk when you ask an economist anything. He or she will say it all depends, or it's very complicated. Well, it is actually quite complicated, and you're going to try and explain why. And the second message, that there's some really important complementarities between anti-poverty policies and healthcare responses to the virus. And those complementarities are hugely important to an effective response in many respects to both the virus and to the economic and social implications of the virus. Okay, on that first point, the socioeconomic inequalities underlying vulnerability to the crisis, there are a number of issues we've got to think about. We've all heard the World Health Organization recommendations, which a number of governments have ratified on actions in response to the virus. It's essentially coming down to four things: learning, isolating, washing, and treatment. We've got to keep this in perspective. Learning is about better information systems, and I'll come back to that at the end. Washing, of course, we've all heard these recommendations. How much is droplets versus aerosol is still in discussion, and we now realize that aerosol is relatively more important. So more emphasis on masks than washing. Treatment, of course, access to treatment. I'm going to come back to some of these issues, but for now, the focus is going to be on isolating. One of the striking things we've seen, it's not rigorous evidence, but it's pretty conclusive, that once with opening up after the virus, or premature opening up, we're seeing large escalations in cases and deaths, with a lag. And I just give you some evidence here for the United States on the left, and the states within the United States on the right. The premature opening up has led to a dramatic escalation of cases to levels far in excess of what they were in April and May. And also the states of the United States, which have opened up, have reopened faster, have tended to see larger escalations in their caseloads. A number of socioeconomic covariates underlying all of this. I'm going to try and unpack it to try to disentangle some of the socioeconomic inequalities that underlie those dramatic pictures. The complexities arise from a number of things. And when we really think about it as economists or social scientists, there's not a lot that's very obvious about how these socioeconomic inequalities impact on the spread of the virus. And our concern is both about the virus, but also about the broader issues of how socioeconomic inequalities in health impinge on our overall assessments of social progress and the longer term implications of that. But a number of the things that matter: wealth-constrained behavioural responses, adjustment costs. People are not going to be able to instantly adjust to a new equilibrium with much lower levels of interaction. And that adjustment process is going to be costly. We have to understand it. Also, there are multiple covariates here, many things in play, and disentangling their effects can be important. For example, I'm going to talk a bit about the disentangling the relative importance of race versus poverty in the United States. There are nonlinearities with respect to incomes that are hugely important. And those nonlinearities may or may not imply that inequality is bad for social distancing and the spread of the virus. There are lots of lags, dynamic effects we have to think about. And throughout all of this, the quality of our data, reporting errors are a major concern, and lags in reporting. And I'm going to come back to all of these things. What we've done, this is the paper with Caitlin Brown here, is in the audience. What we've done is merge data sets across a number of sources on recorded deaths, different sources there, the Center for Disease Control versus the New York Times, differences in how those data are collected, and you've got to be careful about that. We're going to merge that with socioeconomic data at the county level for the United States, about 3,000 counties. If we had microdata fully integrated with individual characteristics, we could use that microdata to investigate a lot of these issues. Of course, there are also area effects we've got to think about. And we're also going to combine that with some of the modeling and the variables suggested from the standard epidemiological literature. Okay, what we've got to think about here is social distancing from the point of as a behavioural response. Governments do dictates, the WHO does recommendations and so on, but those dictates and recommendations are always subject to a compliance issue from individuals. Do they want to comply, and do they quickly adjust to those recommendations? We've got to think about the benefits of social distancing and how they weighed against the expected losses from the virus. So we've got to get inside behaviour, inside the rationale that people have for compliance with recommendations on protection from the virus. Social distancing creates a lot of costs. It curtails personal interactions that have value. And those for individuals are going to have to weigh that in a difficult decision, weigh that against expected losses from the virus. The marginal cost of extra social distancing will not be the same for everybody. And we emphasize in the paper, the work with Kate Brown, we emphasize that poor people may have a much harder time complying with these recommendations. And there are a number of reasons for that, which I'm going to come back to. And as I've emphasized, there will be adjustment costs. Weighing the benefits and costs, we have to think about that in a formal economic sense. I'm going to sketch a little economic model that tries to capture this behavior. We have adjustment costs. People have each person is assumed to have a customary level of interaction in society. And that, when I say interaction here, I'm talking about economic, social. It could be economic in the sense of how you derive your income, or it could be economic in the sense of how you dispose of your income. But in both cases, it requires a certain amount of interaction. You've got a customary level of interaction. That's not the same for everybody, obviously. There's a general expectation that the level of interaction tends to be higher for richer people, that poorer people tend to be more socially isolated. Now, there are exceptions to that, of course, and it's only a generalization. But when we just see that, we're going to expect marginal costs of social distancing to differ. Starting from zero, we're also going to expect that a small amount of social distancing will not probably come with much loss, but this will tend to increase as you approach full lockdown. The loss from lost interactions will be very large indeed. And we also assume that the net marginal benefit of social distancing is decreasing in the amount of social distancing for exactly this reason. The first initial amount of social distancing, probably not too much of a loss, but as you proceed, more valuable interactions are foregone, and eventually we end up with a large potential loss. Now, we can formalize that in terms of an economic model where we think of the cost of social distancing and we think of a benefit of social distancing. The cost includes a current adjustment cost, where you've got to change the way of behaving in a society and an economy. You've got a customary level interaction. You've got to get a below that. You've got the customary level interaction implies a customary level of social distancing. You've got to get a larger amount of that social distancing, and that cost is also going to come with heterogeneity. There are, for different people, different costs, and you're weighing that against the probability of infection times the loss from infection. So you're weighing this current adjustment cost against this expected future loss. There are also, of course, benefits from foregone benefits from social and economic interactions associated with any degree of social distancing. You put all that together, you have two effects on social distancing and hence on infection probabilities. The first is what we call a protection effect, and the second is an adjustment cost effect. The protection effect, the important thing there is that how marginal benefits of social distancing vary with income. And as I've emphasized, our prior there is that poorer people tend to face higher marginal costs, lower net marginal benefits. Now, in many ways that could happen. One of them, the most important, is that for many poor people, they don't have the buffer stock, they don't have the savings, they can't just sit at home. Also, their jobs don't permit that. They'll be losing income, they'll be losing employment. So the protection effect could be quite important. But again, there's an adjustment cost effect, and that could go in the opposite direction. As I've emphasized, if richer people tend to interact more, it's part of being wealthier, and their adjustment costs, then we could also see an offsetting effect on the socioeconomic inequality associated with socioeconomic inequalities associated with social distancing coming from that adjustment cost effect. We're going to look for both of these effects. We're going to try and disentangle it to see whether both exist, and we're going to argue they do, and they do go in opposite directions. But on balance, we're going to argue the protection effect is dominant. In other words, it's poverty is a dominant factor in an important factor, dominant over the adjustment cost effect in explaining social distancing and the spread of the infection. Another area of ambiguity is age. We've seen a lot of talk about this, and the concerns that older people tend to be more vulnerable to serious illness once infected. Not as much attention to how age affects the probability of infection. And that's primarily through social distancing responses. So we're going to try and make that distinction as well. How much does age matter through both the probability of death conditional on infection, and secondly, through the probability of infection? And the second one we're going to argue is actually quite strong. And we're going to present a somewhat striking result that these two effects are roughly offsetting. Also, there are a number of correlations we've got to think of. There's so many things going on here, and in the background paper for this talk, Kate and I give you a host of alternative scenarios on control variables and the types of characteristics you're looking at and so on, to try to assess the robustness. Some of the results we talk about are more robust than others, and then clearly there's a certain amount of concern about how to disentangle these correlated confounding variables. But we do the best job we can, and I'll show you the results soon. Once we think about the micro behavior underlying social distancing, we have to then aggregate to get an infection rate and an aggregate social distancing. That's a straightforward exercise. There can be all kinds of interdependencies and externalities involved here, but the basic thing is going to be that this second equation here, that the aggregate infection rate, that's cases per capita of the population, is going to be the expected value of this solution function from our model, which gives the probability of infection as a function of income and characteristics of the individual. And similarly with social distancing. Now, the point of raising all that is going to be that the nonlinearities in this relationship, how this probability of infection varies with income, in this reduced form relationship. And similarly, how social distancing varies with income. That the nonlinearity of that relationship is going to determine to what extent income inequalities in particular influence the aggregate infection rates and the aggregate social distancing in a society. That's an application of an old theorem in mathematics called Jensen's inequality. Anyone familiar with utilitarianism going back to Jeremy Bentham, well before Jensen, but Jeremy Bentham will be familiar with the kinds of arguments we're making here. It's going to depend on the concavity or convexity of these relationships, if in fact they have monotonic curvatures. So we're going to try and figure out, on balance, is it the case that inequality is good or bad for social distancing and infections? A simple intuition would be, and this would be one example, if the marginal increments to social distancing from extra income tend to be higher for poorer people, then higher inequality will tend to reduce social distancing. And that's just here's an example I've drawn here of the nonlinearities involved. Here I've got a concave social distancing function of income and a convex infection rate curve as a function of income. In those cases, you can see here that the level of social distancing at mean income is going to be higher than the expected level of social distancing given the distribution of income. And that's just illustrating a case where inequality is reducing aggregate social distancing, and similarly with increasing the average infection rate in the society. But these are empirical issues. This is only one possible scenario, so we're going to try and figure this out. All kinds of other inequalities matter. I've emphasized the inequalities stemming from the inherent nonlinearities in the behavioral responses. There are others too. I mentioned the problems of cooperation in unequal societies. There's a degree of cooperation is necessary for pandemic response. We're not seeing that too much of that cooperation globally, and in some areas we see less of it. And that's tied again through arguments that go way back in economics, arguments about how inequality impedes the provision of public goods in society. Another issue is the dynamics. So far I've talked about the equilibria in behavioral responses where social distancing is behaviorally optimal, and we try to build that into our understanding of the infection rate. All of that should be built into a dynamic model, if only because of lags in reporting, but also lags in response. Here I've given you a very simple dynamic specification, which has our theoretical model as the steady state solution, but in any one period, that may not be the case. The reason I emphasize that is that this focus on cases per unit population misses the fact that it may not be homogeneous. The relationship, the cases per unit of population may depend on the population. And that's going to happen if only because of the dynamics, because of the lags in this. So, and I've just illustrated that point here where the response rate, the elasticity to population, this gamma here, will be less than 1. In other words, infection rate per capita of the population will vary with the size of the population as we move towards the equilibrium of this whole horrible story. We're also that also means, importantly, once we consider the dynamics, we're going to have to worry about the endogeneity of cases when we model death conditional on infection. This is not something we've seen any attention given to, but it is a problem. As econometricians, we have to worry about endogeneity all the time. And here there's if the cases if deaths per case depend on the number of cases, we're going to have to worry about the endogeneity of the number of cases on the right-hand side. We make an argument in the paper for an exclusion restriction, what we call an exclusion restriction for identifying structural relationships, which comes back to the epicurve, the famous epicurve, which says that new cases will tend to increase and then decrease at some point, and cumulative cases will be nonlinear. We use that for identification under an exclusion restriction that says essentially that the epicurve matters to the cases, but it doesn't matter to the death rates conditional on the cases. Now, like all exclusion restrictions in empirical work in economics, there's always a question. And here the question that arises is whether there could be hospital capacity constraints in some areas, for example, which could mean, could violate this exclusion restriction. So what we do is try to control as carefully as we can for healthcare, the local capacity of healthcare systems when we model death rates. Well, what do we learn from all this? I've listed here the basic data sets we're using. For social distancing, it's both the unicast social distancing scoreboard based on mobile phone GPS data. We're also going to use the Google COVID-19 Community Mobility Report, which gives us continuous variable tracking changes in visiting and time spent in various activities. We're going to use two sources for cases and deaths, both the Centre for Disease Control and Protection. Here, in all of this, we're using the most recent numbers available at the time of writing. So the CDC data we're using here is for June 18, cumulative cases and deaths up to June 18, 2020. And we're also going to use the New York Times data site, which has been fantastic. What the New York Times has done here is really impressive. But there are problems for our purposes in the New York Times data. Importantly, the data records things according to where the county in which they occurred. The event is identified by where that occurred, whereas the CDC data tracks it to the residence of the particular person. And that's a difference that is salient. In the end, it's not going to matter very much to any of the qualitative conclusions we draw. We're also going to use data on excess deaths from CDC. Excess deaths meaning when we look at the deaths in any time period, say the last month, we compare that to, say, a moving average of the same month in previous years. And that can be important to try to get at reporting problems. Testing data at the state level is far from ideal. Pretty much anywhere. It's improved a lot in the US, obviously, but it's still less than ideal. Health indicators we're going to take from the CDC. The basic econometric models, we have three essential equations: the social distancing equation, the cases equation, and the deaths equation. Social distancing based on those two sources I identified. The cases equation and the deaths equation. Notice here that we're relaxing that homogeneity. So you see here, for example, this is written in an exponential form because cases can be zero, so you can't log it. But you can interpret these parameters as elasticities, and this parameter alpha 3 on the log of n, that could easily be a number other than 1 for the reasons I've talked about on the non-homogeneities generated by dynamics. Deaths, similarly, we're also looking at deaths conditional on cases, and this parameter beta 3 could be different to unity for the same reason. Importantly, both the cases and the deaths data are highly overdispersed. You can't just run ordinary regressions on this kind of data. It'll give you some silly numbers. The overdispersion here, that just means a very high variance relative to the mean, is associated with the nature of the spread of a virus like the new coronavirus, and it's not no great surprise. It's going to be concentrated in certain places and it spreads to others, and that creates this overdispersion we've got to think about. So this naturally leads us into what are called negative binomial specifications, which we estimate by maximum likelihood. Social distancing, we have a continuous version and an ordinal version. The ordinal version, we're going to use an ordered loaded. What do we learn? First thing that stares at us is the strong relationship between social distancing and infection rates, and it's quite strong. I just plotted here on the left. You see, this is performance in social distancing on the horizontal axis. On the vertical axis, reported cases, and on the picture on the right, I've just given you the proportion of counties that have infection rates above various numbers. So here, infection rate above 400. That's showing you the proportion of counties at each level of social distancing. So as you move from the left to the right, we see more social distancing. And as we see that more social distancing, we tend to see lower infection rates. and lower extreme infection rates as well as low mean infection rates. Now, of course, this is not a causal picture. This is a descriptive picture. It's just telling us what we see in the data. We're going to get to the structure right now. These are our regressions for improving social distancing. A number of effects to note. So here we're just, these are ordered logits for the unicast social distancing scoreboard data. The density variable, it comes out quite strongly. This is, we have a variation on population density with the popular variable in epidemiological models. We argue that it really should be potential interactions in a society, which is for relatively large population sizes, is going to be the population squared per unit land area as the number of potential interactions, not the actual interactions, the potential interactions between any n people is going to be approximately n squared. So we make that little refinement to the epidemiological models, but basically that first equation is essentially a basic epidemiological model. And we augment that for a bunch of socioeconomic variables: median household income, share of the population 65 and older, the Gini index of income inequality, the official poverty rate, and the share of Black Americans in the population. I also mentioned that we have to control for the days since the first case. This is not so important, obviously, for social distancing. I don't expect it to be that important. Well, it could be, but empirically, it's not a strong predictor. But it's going to be hugely important when we talk about cases and deaths. Very strongly, the richer counties, higher median household income, are tending to see greater progress in social distancing. I emphasize that the dependent variable here is the improvement in social distancing relative to a baseline. So we're seeing in richer counties more response through social distancing. We're also seeing, and this is quite strong, older populations, counties with relatively older populations, are seeing larger responses through social distancing. That effect is going to some extent, we're going to see how much, to some extent is going to counteract the effect through death conditional on cases. And I'll come back to that and we'll see just how much it counteracts. We're also seeing effects of the poverty rate. Counties with higher poverty rates are seeing larger improvements in social distancing conditional on median income. But when we turn to the cases, things get quite striking. There's a lot of systematic effects in the prediction of infections due to this virus. Strikingly, we're finding that the elasticities with respect to population are significantly less than unity, as I discussed. We've got a tendency for the infection rate, cases per capita, to be lower in larger populations, as recorded. Strong effects of the number of days since the first case. Strong effects of median household income. But one of the really striking things here is that if you put median household income alone without the poverty rate, it comes in negative. But the reason for that is entirely the correlation between median household income and the poverty rate. So the fact that we're seeing higher infection rates in richer places is entirely due to the fact that they have lower poverty rates. Higher poverty rates, on the other hand, controlling for median household income, tend to be associated with higher infection rates, and that's an inequality effect. Inequality on its own matters, but poverty matters conditional on mean household income. So if you control for the mean or median household income, what's left in a poverty rate is essentially a distributional characteristic, how pro-poor the distribution of income is in a county. And that effect is quite strong. But really striking, when we add in the share of African Americans, it knocks out the inequality variables. It doesn't knock out median household income. It doesn't knock out the share of 65 plus, which tends to be associated with lower infection rates, presumably because of lower social distancing, higher social distancing by older people. But look at what happens when we control for the share of Black Americans. Really knocks out poverty and inequality. So it's not the immediate proximate cause is not high levels of poverty or high levels of inequality. It's the fact that those things are so correlated in America with the share of Black Americans across counties. Okay, I've summarized all of this here. So I've said all this, so I'm going to move on. In terms of back to the theoretical model here, in disentangling the protection and adjustment effects, we see evidence of both of them in play. But overall, the protection effect dominates, and when we solve it out or remove the poverty rate from the regression, the effect of median household income is negative, not positive, it's negative, but that's entirely due to the poverty rate. So we interpret that as evidence of the protection effect and evidence that the protection effect is dominant over the adjustment cost effect. And the adjustment cost effect is still present, as we've seen, through when we control for median household income. A complex picture on income inequality is emerging here, as you can see. And I've mentioned most of these points, but another point that's important is we're not just talking about inequality within counties, we're also talking about inequality between counties. And that too matters. It's not just about the impact of higher inequality within counties. We're also seeing that higher inequality between counties in the US is increasing the overall infection rate. And as I've said, it's much more a story about racial composition than about distribution per se. Those two things are obviously highly correlated, difficult to disentangle. But on a purely statistical basis, we'd argue the more important immediate covariate is racial composition, which you can think of as a fractionalization aspect of inequality, of course. It's another aspect of inequality, a very important aspect of inequality in America. But our investigation points us very much to thinking about that aspect of inequality in the context of the spread of this virus. Another point we find is we're very curious to know what happens over time as this virus spreads. Do these socioeconomic inequalities become less important or more important? They can become less important if people mix. Epidemiological models often talk about mixing, but here it'd be a mixing across socioeconomic groups as the virus spreads. On the other hand, you may get the opposite. People who can protect themselves, relatively better off people, older people, are going to mix less as the virus spreads, and they learn the importance of social distancing. What do we find empirically? Well, pretty much overwhelmingly it's the second, not the first. We don't see a fading of these socioeconomic inequalities over time. We see a magnification. And that's very alarming, particularly in issues like the effect of a higher share of Black Americans. It actually starts off slightly negative, but I wouldn't put any significance on that, but pretty soon becomes positive, and the effect increases over time as days pass. It doesn't fade, it becomes more important. The racial fractionalization aspect of inequality in America is of rising importance to the infection rate in this country. And a similar pattern for other socioeconomic dimensions. The one exception to this is about the elderly population. Here we do see a mixing effect. We see a fading of the importance of an elderly population through social distancing and infection rates as time progresses. I guess younger people are learning. They don't seem to learn very quickly, but they're learning. Okay, I want to briefly talk about a second message, which carries us to policy implications. And part of the reason we're emphasizing this is joint work again with Caitlin Brown, but also with Dominique van der Waal at the Center of Global Development. Why we're worried about this is that when we think globally, we start to worry, of course, about social distancing. We start to worry about a lot of other things that are going to matter. And what occurred to us is the home environment. I've been working, Dominic, too, with poor people all over the world for decades, and we know it's obvious that many of these recommendations from the WHO and national governments are really a bit of a fiction from the point of view of poor people. They would have a hard time complying. Also, some poor people in the United States, of course, but globally, you start to think, well, how many? At least the question arises: how many people really can protect themselves? And what are the implications for social policy? That was the second question we're going to address here. How much of the WHO recommendations are applicable in poor places? But now we're going to take a global perspective. What we do here is draw on data on about 1 million sampled households over the last 10 years from the demographic and health surveys. And what we're trying to do is, in a sense, paint a picture about their home environments and the circumstances of their lives as relevant to their ability to protect from the virus. We're going to emphasize the importance here of household infrastructure, and we're also going to emphasize, using the data, how much wealth, how much this is a poverty issue across the world. Now we're talking globally. We're using surveys for Sub-Saharan Africa, Central and South America, Asia, Middle East, Eastern Europe, and North America. Unfortunately, we're not using anything for Brazil. The latest demographic and health survey we know of for Brazil is 1996, and we think that's just too far out of date. We set a somewhat arbitrary cutoff. The survey couldn't be more than 10 years old, because clearly we want to get as best we can. And most of these surveys are really in the last 5-6 years. We want to get as best we can a picture of circumstances at the outset of the pandemic. We try to look at a number of things in the demographic and health surveys that are relevant to the household's capability to protect itself. Communications is going to be one important one, as I emphasized right at the start. So we asked, does the household have at least one of the internet, phone, land or mobile, TV or radio? In other words, can it get messages? Messages might be on the importance of wearing a mask, or how to make a mask, or they could be on local outbreaks, or they could be on access to social protection, how to afford to stay isolated. So infrastructure, communication is going to be important. That's one of the things we look at. We also look at density. Clearly, if you've got 10 people to a room, it's really going to be, you're going to be highly exposed. If one of those people gets it, you're going to get it. So we look at the density of people within the home, and we drew a line at 2 people per sleeping room. We also ask whether the household has a toilet that can share with, or does it have to share it with others. If it has a toilet on the premises somewhere, in the dwelling or in the land, in the property, or if it has to leave the premises to go to the toilet. Also, does the house exist as a recognizable house? Does it have walls and ceiling? Is it containable in that sense? Piped water. Do you have water into the house? Is it a private source? Do you have a place for hand washing with soap? Basic attributes of the home environment, which would certainly help you protect yourself. Well, what we see is pretty alarming. Globally, basically, about 40 in our data set, about 14% of people live in households that can comply fully with the requirements of the conditions I just listed. And we've got some issues about missing data. If we actually look at those surveys where we have complete data on everything, it falls to about 10%. Only 10% of households have home environments that would allow them to comply with everything I've listed there. When we look at poorer households, so here I've given you wealth quintiles from the poorest to the richest. When we look at the poorest quintiles, it drops to about 4%. Only 4% of people in the poorest quintile, about even 6% in the poorest 40% of households, can comply with everything there. Now, some things they comply with better than others, and thankfully, the communications aspect is not so bad. Roughly 2/3 of the poorest 20% of households. You can get much more detail on all of this in the paper with Kate and Dominique, but I'm just giving you a quick summary. What we see for communications is a bit more encouraging. As you can see in that top row, we're talking about 2/3 of households in the poorest quintile have one of these communication devices, and it's nearly 90% of households averaged overall, and almost totally complete for the richest quintiles. But other things are much more alarming. A water source in the dwelling, very low numbers. Having a place to wash hands with soap, the vast majority of poor and relatively poor households do not have that. And the density variables also quite high. The majority of the poorer households, majority up to all except the top 40% of households, live in relatively high density dwellings. For sub-Saharan Africa, if you look at the overall index of compliance with these household environment attributes, when we talk to the poorest in sub-Saharan Africa, it's basically zero. Virtually nobody can comply with, amongst the poorest 40%, can fully comply in sub-Saharan Africa. So summarizing this on learning, we read this as pretty good coverage overall, so that's encouraging. Isolating, not so good, and hygiene, not so good. Those are going to be real challenges. And of course, they're real challenges in the short term. I think I've summarized all that. So one important caveat on that is that, why do we talk about full compliance? I give you results here for partial compliance, where we ask, can you satisfy at least K, where K is some number up to 6 of the conditions I've identified, and you can get more detail on that. There's that 90 at the bottom right. There's that 10% figure. This is for the 40 countries where we have complete data on all of the attributes. About 10% of households can fully comply. But of course, as you go to if you only talk about complying with one of the attributes, it's virtually universal. It drops off very quickly after about 2 or 3. Okay, I'm conscious of time, but I want to point out almost the last point I want to make here. This also holds across countries. When we look at the relationship between our index of household environment for protection, and we plot that against the log of GDP per capita, a very strong relationship. I've given you the results here for K equals 6. That means compliance with all 6 of the attributes versus K equals 4. A very strong relationship across countries. It's poorer places, and it's poorer places in poorer countries where this is going to be a concern. So let me conclude. A few general comments here. The world's poorer are more vulnerable to the virus. And when I say poor, when I say inequality, we're talking about poverty and inequality across many dimensions here, not just income, racial fractionalization aspects, for example. But richer countries, and especially richer people, are better able to protect. That's coming up pretty strongly. Developing world, especially the poorest half, is ill-prepared to self-protect. This is very worrying. Poor places, even in rich countries, are less able to cope, and social distancing is harder. It's a huge economic challenge for poor people, and infection rates tend to reflect that fact. Socioeconomic inequalities certainly underlie the spread of the virus, but also they're reinforced as the virus spreads. The effects don't fade, they magnify. Policy implications, this is not easy. There are a lot of things here that just can't be done in the short term. I mean, these issues about the home environment, this is going to be, you're stuck with that for a while. It hopefully emphasizes the importance of these infrastructure variables in the longer term. This is not the last pandemic, but not much you can do in the short term. But there are things to do. The importance of cash and food transfers is emphasized, and a lot of developing countries are making progress on that front. We're seeing a lot of encouraging progress. Some places more than others, obviously. But there are things you can do in cash and food transfers that simply try to allow workers to stay at home without huge economic repercussions to their lives. Much more could be done, but it's clearly hugely important. The current infrastructure of information is encouraging and holds promise for getting the messages out. And that's going to involve leadership. It's certainly going to involve leaders of governments wearing masks in public. It's going to involve a lot of basic information. And I think we're all struck with how important this is and how poor information is. The countries that have been very successful, and one of the most successful in fighting the pandemic, has been Vietnam. And they went all out on this right from the start. They just dumped so much truth on the false facts that were floating around about this virus, that pretty soon everybody in Vietnam knew, pretty much everybody knew, that this was not just a seasonal flu. This is something to take very seriously. Of course, in Vietnam, it helped because of the experience with SARS previously, but they did a lot of stuff on information, pop songs, a lot of things that just got everybody in tune, aware of what's ahead and what they need to do personally. A lot of things you can do in getting soap and water, I mean, including soap with food packages. I know we're putting a little bit less emphasis now on the droplets versus the aerosol, but I think everybody still agrees this is important. But in all of this, I'm struck by the need for homegrown innovative adaptations. What Vietnam did, what Uganda has been doing, also doing a great job. Better than many rich countries, I'd say, including the United States. And that's adaptation. It's recognizing that you have to adapt policy to the realities of the setting. The WHO recommendations are terrific. How are you going to do that in really poor places? You've got to figure out how to do it. Okay, folks, thank you very much for your attention. I'm sorry for all the technical hiccups at the beginning, but thank you very much and take care, everybody.
Okay, thank you so much, Professor Ravallon. Now we can go straight to Professor Nairson Menezes' comments.
First of all, thanks very much for the invitation to participate in this seminar. We are living through important times of COVID and isolation measures and their effects on the GDP growth and income and unemployment. So the theme is excellent, and I really like the talk of Professor Ravallon. I've been following his work for a long time, especially in poverty and inequality in developing countries. And I would like to start my comments by saying something first about the papers themselves and then about Brazil. In the papers, I pretty much liked both of the papers and the empirical specification and the results. But one thing that I would like to listen to is Martin's comments about the role of social distance measures, for example. We know that the behavior of the president of the country or of the governors or mayors in the cities or counties are important drivers of social distance. For example, in Brazil, I've done some econometric regressions, and if you plug in the equations, the measures taken by the governors or municipals, they explain a large chunk of the infections and deaths. And I wonder what are the political economy effects of these measures? Because why do some governors or president or mayors take decisions on or take a stance on social distance while others not? Are those decisions correlated with the socioeconomic characteristics of the population or with the spread of the infection? And so if you have data on the changes in the legislation related to COVID over time, would they, what would be their impact on the estimated equations and on the effects of the covariates on social distance, number of cases and deaths? So I think what this COVID, in more general terms, what this COVID pandemic taught us is that it's very important to have good governors, good presidents, and and that will be very important. That will have a very important effect. For example, some papers have showed that when our president made a speech against saying that COVID didn't matter, social distance increased, especially among the president voters. So I think it would be nice to try and understand your views on the effect of this more political measures. And it's possible to get data. We are collecting data for Brazilian municipalities. And the preliminary results, as I say, show an important impact. Another potentially important factor in determining, for example, the number of deaths is the number of deaths from other causes as well. For example, in Brazil, lots of people used to die from traffic accidents or crime. And if people stay at home, for example, you would observe a decrease in the number of deaths from these other causes, so pollution as well. And so for a given availability of hospital beds, you could have lower deaths, for example. So this would be another factor to take into account, I think. And I would like to know your views about that. In terms of the Brazilian case, we have had a bad experience in terms of the number of cases, of course, and the length of the episode. So we still have more than 1,000 deaths a day in Brazil. But on the other hand, we had a very good cash transfer program introduced after the initial of the pandemic. So the Brazilian Congress and the government implemented a policy transferring around 600 reais, or even up to 1,200 reais. So about $300, more or less, per month for poor households to cope with the isolation measures, so lack of employment, income drop, and all the effects of the pandemic. And it's impressive because the effects of these measures, if we look at the new household data that's being collected now by the IBGE, you can check that inequality actually decreased with respect to the previous numbers before the pandemic. So we now have a Gini coefficient of 0.49, which is the lowest in the history in Brazil. And we also have extreme poverty incidence of about 3%, and even poverty itself. So the inequality that has always prevailed in Brazil was so explicit after the pandemic, because poor kids were not going to school and they were more likely to die, as your regressions show, that created a momentum for the introduction of very generous cash transfers to poor families that were not possible before, because those numbers, the size of these transfers, are much higher than the ones of the Bolsa Familia program, for example, and had a huge impact, as I just said, on poverty, inequality, etc. So it's an interesting political economy theme, because perhaps it's necessary to have a crisis of this size so that everyone agrees that strong pro-poor measure should be taken, whereas in normal times this wouldn't happen. And we now are facing with the problem of a transition, how to transit from a successful emergency cash transfer program that costs a lot of money, of course, So we probably wouldn't have enough money to stay with this program forever. So how can you transit from a program like this to another program? Because people wouldn't accept the traditional Bolsa Familia with this, I don't know, $50 per month transfer. So now the government and the Congress are discussing this transition. And I'm saying that because I know you have a long trajectory on analyzing cash transfers and developing countries and poverty. And so it's a very interesting experiment we are having here in Brazil. And I would love to know your opinions about that. So those are my general comments. So I think we can open for the audience or listen to your views about that. Thank you very much for the excellent presentation. It was a great opportunity for us to know more about your recent work in the area. Thanks.
Thank you, Professor Naircio. I'd just like to consult the panel if it would be okay for us to extend a bit the time, since we had a bit of technical problems at the beginning. We're allowed to stay for a little longer. Would that be okay with both of you?
Yeah.
Okay. All right, Professor Ravallon, you can respond to Professor Naircio.
Yeah, thank you very much. There's a great comments. You can hear me? Yes?
Yeah.
Yes.
Yeah, good. I've been thinking about the political economy aspect in the US, but very interesting to hear what your comments about Brazil. And I think there's a lot of scope for understanding that better. Obviously, there are concerns about the endogeneity of the political response. We played a little bit about this in the US, and looking at, for example, whether you had a Republican governor, or there are effects in the data, but again, they're correlated with a lot of other things. But it's important to understand that better. So I'd say, yeah, further work is needed. The point you raised about deaths from other sources is valid. I can't say it for Brazil, obviously. This is something we looked at with the excess death data, because the excess death data doesn't attribute any death to anything. It just says, are there more deaths than we would have expected, given for that time of the year, and given past history? The excess death data, I think it'd be fair to say, tends to be suggesting higher deaths than the recorded COVID cases. And the general presumption is that that's reflecting people who don't seek treatment for in health crises because of the overload on the local health systems and hospitals, and the fact that you go to a hospital with an ailment that nothing to do with COVID, you've got a chance of catching the virus. Hospitals are not very safe places. So people are not getting treatment when they should. And this seems to be, particularly with cardiovascular stuff, it seems to be causing excess deaths. But this is something we want to look at more. Now, I'm just speaking for the United States, obviously. I think I've only written one paper on poverty and inequality in Brazil, but your comments made me think I really got to get back to your country. That was long ago too. But the point you raised about the cash transfers, I read about this, and there's a continuing monitoring of social policy and social protection responses, and very interesting comments. I don't know how general that is, but I've seen what's been happening in Brazil in response to the pandemic with this big push on social protection. I think that's been great, and I have nothing further to add. I think some assessment would be interesting of how well this is working. I think one of the things that the pandemic has done, which on the credit side rather than the debit side, one of the things that the pandemic has done is also deflate a lot of this. I've often thought somewhat silly emphasis on fine targeting in these social protection programs. I think the global financial institutions have been guilty here, but fine targeting kind of strange thing to talk about in the context of a pandemic. Obviously, there's a whole lot of informal sector workers who are hurting badly, who we wouldn't normally consider poor. There's a huge shock here to a large segment of the distribution, talking about fine targeting to the poorest and most adversely affected. It doesn't make a whole lot of sense from either the economics or the straightforward administrative capabilities in the context of a pandemic. So that's another lesson. The numbers you quoted, very interesting. Gini index down below 0.5 in Brazil. This is amazing. Okay, I have nothing further to add. All interesting points, and thank you very much. I think we should probably, you and I should talk further about this. Other comments?
All right, thank you so much. Yes.
No, I have no other comments. That's fine.
Oh, okay. Thank you very much. Professor Nairsu, would you like to respond to some of his comments? Feel free to. Caitlin as well, if you want to say
it's fine.
You're more than welcome.
From my side, it's fine. I think we could listen to the audience as well if they have some other questions.
Okay. So thank you very much for both your interventions. Your speeches were very good, very brilliant. Thank you, Professor Nairsu, as well. We've had over 1,000 people watching us online, which is amazing. And we've gotten some questions from the audience, and then I'll pose a few of them so you can react to. We still got some time left. So let me start by one that I think touches upon a bit of a macroeconomic aspects in terms of collateral effects of this pandemic that refers to the United States and its health system. So the United States does not have a public health system, a universal one, and many people tend to go into debt to get treatment against the coronavirus. So how could we reduce the economic impact of these accumulated debts that tend to pile up throughout this pandemic on the lives of the poorest population? So I remember that in the paper with Caitlin on only, you talk about one of the fears that the poorest population has, that is, in exposing itself to the virus, it may entangle itself into a lot of debt and let's say, foreseeable expenses with the hospital billing and so forth, which in the US tends to be tremendous. Now, the second question before I pass the word to you goes into Vietnam's strategy. So I think if we could elaborate a little bit further on how they went into a strategy of distributing food for people instead of money, a sort of like a natural good kind of transfer directly. I think it would be interesting to understand that experience. So I'll start off with these two, and then if we got time, we can come back to other questions. So Professor Ravallon.
A long time, and public insurance in particular. And I'm hoping that this pandemic is going to shake people up a bit about that. Obviously, countries that have more universal healthcare systems, even single-payer systems, are dealing with this much more effectively. It's really difficult here in the United States, and we've seen in recent times some 5 million households who have lost insurance, not just out of it. I mean, don't have health insurance in this crisis. And, you know, people can come back from COVID, they survive, but they've got huge bills, absolutely humongous. And that's is throwing them to, as the question indicated, it's throwing people into poverty. But that's all I can really say about it. I can only hope, let's just keep making these arguments. You know, healthcare is one of those things for which we have to be very careful about purely market-based solutions, because there's so much scope for sharing risk, particularly health risk. And the bigger the pool, the more the sharing that goes on, and that's the basic logic of universal healthcare systems, single-payer systems in particular, and also, of course, their ability to control the prices of drugs and the prices of treatments. So the kind of free-for-all you get with a market-based solution is can be a disaster, and when a pandemic hits, a real disaster, but even normal times. And Vietnam, the food versus cash remains an issue, and I don't know what the experience in Brazil is. I know Brazil relies much more on cash, but the fundamental thing is how well our food market's working. The kind of thing we saw in India and with this ridiculously fast lockdown, within hours you had to be locked down, and it so disrupted food markets that unless the government could somehow get the food to people, getting cash to people isn't going to help very much. Markets are closed. You can't go and buy food. It's not like you're going to get a Amazon delivery. This is really important. So then it becomes a really difficult thing in terms of physical delivery. What Vietnam did was quite effective in terms of using local community groups. So in each little geographic area, we're talking about villages, even natural villages, you would have somebody in charge of reporting on problems. A particular household was clearly in distress, and getting that information out. And the food was delivered to the doorstep, but that the information system was most important in a sense. As long as you had a credible information system with local community reporting, you had a chance. Yeah, and I'm not saying in Vietnam it worked perfectly. There were obviously lots of problems, but it worked much better than it could have. And the general presumption was that you didn't want to open markets. You wanted to close markets. You wanted, in terms of protection from the virus. So as soon as you do that, you've got to think about a food delivery system. The disruption to supply chains on food that we're seeing across the world have been very worrying, but particularly in poor countries. And those disruptions, as I've said in one op-ed very early on in March, we could easily be talking about localized or larger famines associated with the disruption to the food distribution systems associated with this pandemic. And that's something to be very aware of. Again, there are times like this when we've got to take very seriously the limits of market-based solutions. In food, it's never going to make much sense to rely on government distribution in normal times. But there's not a normal time. And markets don't have historically, one of the characteristics of famines has been the failure of markets to deliver effectively. Okay, other questions?
Professor Narcio, do you like to comment on some of these questions? Okay, there is one further. Actually, there are 2 or 3 more questions. The first one, actually, I'm going to use my powers here as a chairman of this session to ask you, Professor Ravallon. There's been much talk, and you touched upon this point now, regarding the role of the state, but not only during this pandemic, but going forward in the post-pandemic era. And we've seen there's a growing feeling, a growing sentiment that the state has, for several years, even decades, put on the back seat and let the market, take the show on. And now we've seen that several aspects of public policy have been diminished or downsized. And this pandemic, for some reason, actually for many reasons, have made explicit that we need, let's say, a more vigilant state. And not only in cash transfer and public policy towards poverty relief or even only reducing inequalities, but further in the quality of action by the state. And I would like very much to listen to you respond to that, on how do you see the post-pandemic relationship in terms of civil society, markets, and state. And there is one last question for now, is that in your opinion, how poor people could stand isolated when stores and business are reopening and they need, to work to keep their families supported? Do you think bringing developmentalism or some sort of developmentalist policies, discussion, and actions back to our government and, overall to Latin America in general could be a good answer to face our problems? The second one touches upon my first provocation. And what kind of problems do you tend to see, arising out of this shift in terms of state action?
Okay. I think probably I'd answer those two questions together. Every crisis in history, to my knowledge, has seen a reconfiguration, a rethinking of the relationship between markets and the state, and this is no exception. This is the biggest we've seen in over 100 years, so I'm not surprised by that. I think social scientists and thinkers about policy have got and public intellectuals have really got an important role here. In drawing out those lessons, but drawing them out in a sensible way. I mean, there's a ton of things that markets do well, and there's a ton of things they do badly. And as I've emphasized, what they do well and what they do badly, it also depends on the context. And large covariate shocks are going to challenge market-based economies under any circumstances, but you remove that large covariate shock, there's a ton of things where markets can just be doing fine. I think in the areas of health and social protection are precisely the areas where we don't trust markets that much. We realize their limitations. And also in related areas of access to credit in particular, a lot of the ways in which inequalities matter I didn't bring it out in my talk, but I guess it's implicit. A lot of the ways that inequalities matter to things like the outcomes, the viral outcomes that we're looking at, depend on the structure of markets, and particularly factor markets, and in particular credit markets. And that's sort of obvious. It's been obvious for a long time that credit markets create a situation where inequality is bad for aggregate efficiency. We've known that, and it's pretty clear. We see it dramatically during a pandemic. All of that, I mean, as public intellectuals, I think we've really got to keep making the case both ways, what markets do well in normal times, what they don't do well, and try to remove this empty, silly debate that says that you're either for markets or against markets. Nonsense. Understand the limitations, where markets can help, where they fail, but also making more effective states. And the pandemic has made it screamingly obvious, and the comments of Professor Nacho brought this out too, screamingly obvious that this huge heterogeneity in governance and ability of governments to act effectively. I've even been surprised by this. I couldn't believe how ineffective leaders have become in many places, and how politicized the debates have become about effective action. Maybe that's more the US than elsewhere, but it sounds like Brazil as well. That's a lesson for us all, and I think it's probably surprised many of us. We've also learned the importance of leadership, and the importance of symbols, and the importance of information more than I've ever more than I expected. And I'd really keep putting that as a top priority. We're in a period when information and evidence is being discredited. And as social scientists and public intellectuals, this is very worrying. People are believing against all evidence a claim that that early on that the virus is just like a bad cold. I mean, believing stuff that we knew not to be true, and we provide the evidence that it's not true. And the medical profession obviously has helped enormously on the evidence, but getting people to listen to it and respond effectively, and that's going to require the support of government, but it's going to require a responsibility that we're seeing singularly absent in some places. And that's generally part of a concern we have about the emergence of right-wing populism. It's populism, not just right-wing populism, by the way. It can be left-wing populism as well, which is very alarming. And I don't know what we do about that, but all I can think of is as academics, we continue to make the case and make the arguments. It's going to be very difficult.
Okay.
Yes.
Thank you, Professor Ravallon. Now, Professor Narsio, I'd like to direct to you. You can comment, of course, on these two questions that I posed, but I think it would be interesting to hear your thoughts when we consider now, as science moves on and understand better how this disease affects our bodies, we have seen that there are some cases of permanent neurological damage. Now, you're one of our top specialists in understanding development in infanthood, in childhood. So how do you see the long-term damage that we can expect coming out of this pandemic in terms not only of long-term growth, but as well in terms of inequality as well as poverty?
Yeah. On the previous questions, I totally agree with Martin, and I think I hope society now starts valuing much more science and health, hospital, and education, and also of selecting good leaders. As I said, we've seen the start of a big cash transfer program. So people became aware that inequality is really extreme in Brazil. We see science on TV all the time. We see that we have a universal health system, the largest in the world, that of course could be used better if we had a better government, but it's actually taking care of the poor people. And I hope people start valuing these things more after the pandemic. And on your other question, I'm sorry about the noise here. On the other question, we know from neuroscience that those kids that are at home may face toxic stress, that is stress for a long time, especially the poor ones that are living with lots of people in small houses, and their parents both stressed because of fear of getting infected, problems with income and employment, and those kids are not going to school, to nursery, where they can have the food in there as well and interact with other kids and the teachers. And if this goes on for a long time, this may they could endanger the brain development of these kids and could have long-term effects on their schooling and ultimately on their job market prospects. So we have to be really careful after this pandemic ends and after social isolation ends on how to take care of those kids to avoid these permanent effects that may happen. And so, especially in early education, we have to have lots of measures and lots of care, and also with the poor youngsters as well in public education. We should have ways to compensate from what they haven't learned in this period. Of course, for the richer kids, it's easier. You can do education, distance education at home. You have your parents to help you out. But for the poor, they are facing really tough problems with accessing education and also facing all these problems at home. So we expect there will be an increase in inequality for this generation, and it's our duty to avoid that this becomes permanent for this generation, and that we are able to attenuate the impacts of this pandemic on inequality in the future. And for that, we need science, we need education, we need health, and we need good leaders.
Okay, thank you very much, Professor Naircio. As we move towards the end of this session, I would like to propose one last question, but upon this question, you can also already give your final remarks, so we can come to an end. And I would like to pick back up one of the questions that Professor Naircio raised at the beginning of his speech, is that it seems to be a lot of noise when you go between levels of government regarding how we coordinate actions in terms of curbing or containing the pandemic. So Professor Naircio touched upon this political economy aspect. So I'd like to go back to it again and say how bad, or how, let's say, how important it is if you have a lack of coordinative effort between levels of government. Is there any possibility of us understanding or somehow infer the impact it has upon the infection rate, as well as in terms of treatment in the population once it is infected? I think this lack of coordination tends to bring some problems, but still I'd like to hear you on that. And on that, could it be that a thorough guideline, if imposed, could ameliorate these problems, alleviate them, and in order to get a better outcome? And again, Professor Martin, if you be so kind to try and move your pointer down on the screen, there is a fourth icon there that says toggle screen sharing. I don't know if you try that, but if you could be so kind to try, we'd like to see you again. There you go.
Oh,
now you're back.
Okay.
Good to see you
I'm actually
again.
physically here.
Yes, no, we knew you were. So if you could, touch upon this question and give us some final remarks before we close, we'll be very grateful.
Okay, well, thank you very much, and thank you for organizing this. I think it's been a good event, and unfortunately, we have to meet this way, but that's part of the story. Your point about coordination is well taken. The lack of coordination in some fundamental sense is also linked back to the lack of trust in government, the deterioration in the credibility of evidence and arguments, and the politicization of everything. And this is I emphasize it's not universal. This is happening in some places. It's not happening in others. And it's hard to understand. It really is. And I don't have any great insights here. I'm not sure how it happened. In this case, in the United States, there's been this amazing polarization, which started back in the 1980s. This is not some recent thing, with this huge rise in inequality, and the politicization of that has been very important. The polarized political, you go back to the 70s, and you didn't have this stark. You had stark polarization between the Republicans and Democrats. You didn't have this lack of faith and lack of trust. You had much more open and intelligent discussions, I thought, just reading the history. So I just emphasize it's not something that just happened overnight. It's something that's been going on for a long time. How that happened is part of a history that we need to understand much better. And how to restore it, I'm afraid it's going to be a long, hard road to travel. What we see now is the countries where that didn't happen, the countries where a consensus around, a pragmatic consensus around policy emerged. But there are also countries where there's a degree of government control, which is has become unacceptable in places like the United States. And the Vietnam case is obvious. And we've seen the benefits of that, but there are costs of that as well, obviously, in other areas. Although a number of things that come to my mind, the longer term costs of this, as Professor Nacho mentioned, in terms of particularly in child development, are very worrying. And poor kids that are missing a lot of schooling and catching up, that'll be a cost going forward, and there's going to have to be a lot of effort to try to redress it. In some sense, this is going to magnify that longer term trajectory in inequality and rising inequality that we've seen in places like the United States. It's being magnified as we speak. There is a breaking point. There must be, where that inequality becomes intolerable, and maybe we've reached that point, and maybe that will be the kind of reversal to this, that maybe this pandemic will bring a benefit there. I'm hoping, and I think we all are hoping, but we don't know. I think a lot of lessons learned, and I'd really emphasize to people, don't disengage about this. I mean, I think we're seeing a lot of research on COVID and the pandemic and a lot of thinking, but as intellectuals, including economists and social scientists, I saw a tweet by an economist I have a very good opinion of, who wrote his first COVID paper. And on this tweet, he said, "Oh, I've just joined the cool kids writing about COVID." And yeah, I see what he's saying. But I also see an important role for all of us, individually and collectively, to mobilize around this time, getting the data out, getting into doing the research as scholars to try to better inform what's going on. And we really have that public responsibility. It isn't going to make great journal articles and so on, probably, but and it's going to be short term. But the more we can mobilize, the more we can help at least create a chance for this to be a serious chance, for this to be a turning point in that long history of rising inequality. Thank you.
Thank you so much, Professor Ravallon, Professor Nacho, if you'd like to make your comments.
Yeah, I would just like to thank you for the invitation. It was a great pleasure to join the team here. And I'm also hopeful. As I said on the start of my comments, Brazil has extreme inequality, but we were able to implement this cash transfer, which no one could ever imagine we would be able to do. So very quickly, we managed to transfer through an app money to about 60 million people in about 1 month. So that was a huge response. And we've seen levels of poverty and inequality that we've never seen before. So I'm sure this was only possible because of the pandemic, because people became aware that poor people, Black people, were dying without hospitals in places. So that changed the perception, and the sense of urgency was able to, in the Congress, was able to implement. And now the president has experienced the surge in popularity because of this measure, so he wants to go on as well. And maybe people will learn that they must believe more in the scientists, they must believe more on the health officials and hospitals, and I hope this happens. And also on the problems of having bad leaders. This can mean deaths, and this can go on for a long time. So I hope people learn this, and we will have political scientists doing lots of research in the future, comparing outcomes in different political scenarios. As you said, coordination between the federal level and the state level and municipal level, and those findings will be published and will become common knowledge. And I think it's weird, but the pandemic may, in the end, have a good change in trajectory. It's unfortunate that such a cost in terms of deaths and sickness. But once this is already happening, let's hope for the best in the future. Thank you for the opportunity.
Well, thank you very
Thank
much, for both of you, Professor Martin Ravallon, Professor Naircio Menezes Filho. It's been not only a pleasure, but an honor to be with you here hosting this session. I believe that you have given much food for thought for us to keep us thinking and doing further research in the future. I think you've raised points that are of extreme importance for us to understand where we're going now. That is, staying home is not as simple as a matter of will, but there are several socioeconomic layers that affect this behavioral response, as Professor Ravallon said so explicitly here, but also the infrastructure for each household, how it can deal with this pandemic. And I think that many avenues of thought and policy and possibilities will be open in the future, of course, once we have overcome this. So once again, thank you very much. Unfortunately, Caitlin was frozen out of our discussion here. It's sad because we were very much expecting to listen to her. And once again, I apologize for all the technical problems we have, for everyone watching us at home, as well to our panel. I apologize sincerely. But once again, thank you very much for all the speeches and all the talks. It was amazing. So thank you. Have a great day.
Thank you.
Thank you.
Bye-bye.
Bye.